Hello guys, welcome to my YouTube channel Rapid Made. Let's start our topic without any further ado.
The title of our topic is growth adaptation. Let's start from the basic. Okay, an organ is in homeostasis with physiological stress placed on it. Okay, an organ is in homeostasis state with physiological stress on it. But if we change, like if we increase in stress or decrease in stress or any change in the kind of stress, then if there is increase, then hyperplasia and hypertrophy occur. Okay, either only hyperplasia can occur or only hypertrophy can occur or both can occur. It depends on the cell type. Okay, and what do you mean by hyperplasia? It's just the increase in cell number. Okay, and what is hypertrophy? It is the increase in organ size. Okay, and hyperplasia occur by production of new cell from stem cell, and hypertrophy occur by gene activation, protein synthesis, or by production of organelle. And it usually occur in permanent tissue, okay, like cardiac tissue, nerve cell, skeletal muscles. And hyperplasia, you have all heard of the endometrial hyperplasia, benign prostatic hyperplasia. These two are the example of hyperplasia. But endometrial hyperplasia can turn into malignancy later, but benign prostatic hyperplasia is benign condition. Okay, the name itself says benign. Okay, benign. And what is the example of the example in which there is both hyperplasia and hypertrophy occur? It's the uterus in a pregnant female. Okay, in it both hyperplasia and hypertrophy occur together. Now let's go to atrophy. Or decrease in stress leads to decrease in organ size. Okay, and what is atrophy? It is the decrease in organ size. Okay, and it is occur by decrease in size and number of cell. Decrease in number occur by apoptosis. Decrease in number occur by apoptosis, and decrease in cell size occur by ubiquitin protease degradation of cytoskeleton. Occur by ubiquitin protease degradation of cytoskeleton and autophagy of cellular component. Okay. In ubiquitin protein degradation, intermediate filament of cytoskeleton. There is a cell, its structure is maintained by cytoskeleton, and its degradation of the cytoskeleton occur by ubiquitin protease degradation. Intermediate filament of cytoskeleton attack ubiquitin and destroyed by proteinases. And what does autophagy mean? Let's go into autophagy of a cellular component involves generation of autophagy vacuole. There is autophagy vacuoles. Okay, and in these contain lysosomes. Lysosomes is hydrolytic enzymes which break down the cellular component. Okay, due to it, the atrophy occur, not apoptosis. Metaplasia. Let's go into metaplasia. What does it mean? It means the change of cell type. Okay, it means the change in cell type. It occur due to change in stress. We have known the basic example, Barrett esophagus. It's the very classic example. To give an example, it's the base. In what condition metaplasia occur? What cells? It usually affect surface epithelium. Okay, like squamous cell, columnar cell, and urothelial cell. Okay, such kind of cells mainly undergo metaplasia. And if there is change in stress, then metaplasia occur. I was about to give the example of Barrett esophagus. In it, what is the normal lining on the esophagus? It's non-keratinizing squamous epithelium. Okay, it's non-keratinizing squamous epithelium. And if there is GERD, gastroesophageal reflux disease, recurrent GERD, then our cells will start to adapt. And because non-keratinizing squamous epithelium is designed to handle friction of footballers, but it is not designed to overcome the acid production. Okay, for to adapt in the acidic environment, it changes into columnar epithelium. Okay, it changes into columnar epithelium. What kind of columnar epithelium? Non-ciliated mucin producing columnar epithelium. We can also see goblet cell in it. Goblet cell in non-ciliated columnar epithelium, because it is best suited in acidic environment. And These have increased chances of carcinoma, but there is one exception. The exception is apocrine metaplasia of breast because it has no chances of turning into malignancy. Another example of metaplasia is in vitamin A deficiency. There is you have heard, I might think you have heard of it. There is a condition called keratomalacia. It is also a metaplasia. And because we all know vitamin A is necessary for differentiation of specialized epithelial cell, such as the conjunctiva covering the eye. But in vitamin A deficiency, the thin squamous lining of conjunctiva undergo metaplasia into stratified keratinizing squamous epithelium. Okay. And this sense is itself called keratomalacia and myositis ossificans. You might have heard of it. It is a condition in which there is production of bone. The muscle changes into bone. If there is, let's say, fracture, and if it's while it undergo healing, there is formation of bone in muscle. So to avoid it, we should not do massage in fracture bone. Okay, we should not do massage in fracture bone. It can precipitate myositis ossificans. Now let's talk about dysplasia. Dysplasia means disordered cellular growth. Okay, most often referred to proliferation of precancerous cell. Okay, it is a precancerous state too. If it is reversible, if it persists for long period of time, then it gets irreversible and can turn into malignancy. The examples are cervical intraepithelial neoplasia. Okay, it can later cause cervical turn into cervical carcinoma, and it can also arise from long-standing pathologic hyperplasia like endometrial hyperplasia, Barrett esophagus condition like metaplasia, long-standing metaplasia. Okay, Barrett esophagus. Let's talk about now aplasia and hypoplasia. What is aplasia? Aplasia is the failure of cell production during embryogenesis. The example is unilateral renal agenesis. And what is hypoplasia? Hypoplasia is a decrease in cell production during embryogenesis. Is the decrease in cell production. Okay, hypoplasia means, and is the failure of cell production. Aplasia means. And the example of hypoplasia is stick ovary in Turner syndrome. Okay, thank you guys. Bye bye. Let's meet in another topic. My another topic will be cell injury.
For more content, please like, share, subscribe, and comment on my channel. Thank you. See you next time, guys.